Hello everyone, my name is Matt Ort. I'm the author of Save Your Company, Don't Feed the Beast. Thought I would do just a brief message today about comparing what we call direct primary care and hospital primary care. These are really kind of a similar group of doctors. Direct primary care doctors are ones that typically have left the system. There are a rare few that have started practices after residency, but most were in the system and chose to leave. And then hospital primary care is what we see within the actual hospital facilities or the local clinics around those hospitals. They're used as a funnel to collect patients, in fact, both in the model of the free market model, the direct care model, and in the hospital model. So very important. But the real question is, what kind of care are we receiving? And I thought I'd just do kind of a quick comparison. So this is page 126 of the book if you want to see a much more detailed analysis, but I thought I'd go through maybe 5 or 6 high points. First, patient panel size. So the typical patient panel size tends to be around 5 to 600 in the DPC, on the independent clinics, the independent doctors. And whenever they hit that limit, then they'll hire another physician to support. The typical panel size is 2,000 to 2,500 in the hospital systems. What does that mean? That often means much less time. How much time do you get? So in a DPC environment, you get 30 to 60 minutes. In a hospital environment, there's research shows that you get about 7 minutes. How about the billing? So the DPC is typically on a subscription model, which means you pay a set amount, or the employer plan pays a set amount, and it's no cost to the member in that case. But you don't have to worry about it. No matter how many things you bring up or how many treatments or how many visits, it's all covered based on a monthly subscription. Hospital primary care, it's based on a fee-for-service basis, and even sometimes people will be surprised. They think they went in for a preventive, which is covered under ACA, and they end up bringing up the wrong thing or something and end up getting billed for something that's not preventive. Overall morale may be harder to measure, but we know the doctor's suicide rate is hitting record numbers, and it's not from independent docs, it's not from direct primary care physicians, it's those working in the hospital. And I've co-founded a website and a tool called Lifeboat for the White Coat. There's a reason we named it that, because many doctors are frustrated with the way they're forced to practice, and the morale is very low, and that's not the person. I respect that person and want to help that person, but that's not the person I want caring for me. Accessibility, my note just dropped. Accessibility, with DPC, we see it same or next day, typically, or for sure that week, typically same or next day. Hospitals, primary care depends on your area and region. I've seen maybe as little as a month to 2 months, and I've seen more than 6 months just to get into primary care. So you've either forgotten what your ailment was by then, or you've already been to the ER or urgent care many times, and your condition has worsened greatly. Maybe by the time you see them, you're needing specialized care that's going to cost more and take more time and so forth. Availability outside of the appointments. Typically, now each DPC is different. The joke is if you've seen one DPC, you've seen one DPC, so they all vary a little bit, but they're much more in common than they are different. Some will go as far as to answer text or calls even on the weekends or off hours, and they'll make a judgment. You need to go to ER, or this can wait till Monday. Some even see patients on the weekends or off hours, and some do not. But typically, especially during off hours, if you need to, or on hours, if you need to talk to your physician, in a DPC environment, they are available. In a hospital primary care environment, typically not. Maybe you can contact a nurse in some cases. We've seen news articles and news stories about hospitals in Madison, Wisconsin actually charging for even emails for just quick questions about renewals and so forth. In DPC, you might be able to just get a prescription renewal with a phone call or a virtual appointment instead of having to go in. Hospitals don't get paid unless they've coded something. So often they'll bring you in even when it wasn't really necessary, when it's a really brief visit and could have been handled with a quick phone call. A couple more, managing chronic conditions, right? So if you don't have time, you're going to be pushed into the pinball machine, and on the hospital side, and getting specialized care, which is going to be more time away from work and more cost and so forth. Where on the DPC side, they can actually take that chronic condition, whether it be diabetes or weight management or sleep management or whatever it may be, and actually just stay in touch with you and talk frequently and help you manage that condition. So again, page 126 of the book gives more detail in that chapter as well. But to me, what's the value proposition for hospital primary care? If we're truly shopping for value, which is the way we set up health plans to do, and the best way to do it, where many health plans aren't set up to shop for value, they're set up to shop within a network, and you have a bad experience and you have bad treatment and you have a lot of sickness and ongoing chronic conditions going on, and you just keep going back. It doesn't make any sense. We would not do that in any other industry. We would not do that with a bad restaurant. We would not do that with a grocery store. We would not do that with a car dealer. So why are we doing that with healthcare, my friends? So DPC is the hub, the heartbeat of the direct care model, and then there's direct specialty care as well, which we could cover another time. But to me, it's a hands down winner every time. So if you haven't learned about or haven't considered DPC, I would certainly suggest that you do. It's a great win for you and your employees, and I don't think you'll regret it.